Muy buenas noches.
Good evening.
Hoy es 17 de mayo,
Today,
domingo.
May 17th,
Son las 19 horas en punto.
Sunday,
Estamos
and
en,
it's 7 o'clock on the dot.
en México.
As usual, we're at the National Palace in Mexico
Vamos a
City.
iniciar la conferencia de prensa diaria
Today, we're going
sobre
to start
la
the
situación de la
daily
pandemia
press briefing on COVID-19,
pandemia causada
the
por
disease
el nuevo
caused by novel coronavirus
Hoy nos vamos a
SARS-CoV-2.
enfocar a dos elementos. El primero es el informe técnico diario.
We're going to focus on two things today. One is the technical report, and the second is that today, because it's May 17th, and today is the day that we are commemorating the National Day Against Homophobia, Lesbophobia, and Transphobia. So it's a day commemorating a fight against all types of sexually based phobias. We think in Mexico that this is very important and we shouldn't disregard this special day. I have the great pleasure of being able to welcome here this evening the president of CONAPRED, which is for the National Prevention of Discrimination, is Monica Macis. Thank you for being with us this evening. So first I will start with the technical report, and then I will pass the floor to Ms. Macis, and then of course we'll have the Q&A so that we can include that very important element.
Llevamos 56 días de la Jornada Nacional de Sana Distancia.
We've been in our national campaign for 56 days now, and what is left are the days on the calendar that are still in green, which is 14 days still to go in this campaign. You'll recall that the national campaign will end on May 30th. However, that doesn't mean that everything's going to go back to normal. We have different states that are still in periods of very high activity of the epidemic, and that includes Mexico City and the Valley of Mexico and surrounding areas. And definitely state authorities, governors, and healthcare authorities in their respective areas will be making, I'm sure, the appropriate decisions at the given time. They will be deciding whether they're going to continue with mitigation measures based on the intensity of transmission and level of risk. So it's very important that we don't end the national distancing campaign because the disease is not behaving in a uniform way across the entire country. We have some areas where there are still very high levels of transmission. I'm emphasizing Mexico City because right now we're in the period of our highest transmission levels, and as well as the suburban neighborhoods around the city. This is where we're seeing a third of the transmission cases of the epidemic. So therefore, the National Safe Distancing Campaign is still in effect, and it is a decision by the national health authorities. All states, all public sectors, both public and private, must follow the national provisions and cannot start the economic activities that have not been considered as essential services. The list is very clear since 31st of March, and this was a general provision for the entire country in all states and all municipalities. That will not end until May 31st. However, if one state takes a decision against that and does not follow those restrictions, they will be violating the law. This could have extremely harmful consequences on public health. And we are going to see the effects in the areas that have lifted those measures before May 31st. So as of June 1st, once the National Safe Distancing Campaign has ended, If we still have high levels of transmission that we're seeing of the disease, which we are going to be presenting here, then we're going to be showing the epidemic period and the cities that are seeing the highest levels across the country. As we said before, state authorities will then make the decisions on which measures they should take. So those provisions can never be lesser than the national provisions until that national campaign has ended. As I mentioned, it's a national campaign. And so the states can make decisions after that period is over, whether or not they want to maintain those measures, and those extend to education, social, and economic spheres. The aim is to reduce infection through measures that we know, which is reducing mobility in public spaces. So this needs to be totally clear. So 56 days in. So now let's look at the international picture. You are already all familiar with these graphs. So here we can see the relative contribution of every region in the world. The Americas is 49.5%, and that represents the number of cases. Europe is still declining. It's sitting right now at 29.9% of total registered cases in the last 14 days. And the Eastern Mediterranean, they also continue to be declining. And countries that are in that region are still continuing to have some transmission levels. The fatality rate has been stable, as I mentioned before. It's varied a little bit. It was 6.3 a few weeks ago to 7.4 at one point, and now it has stabilized around 6.8, 6.9. So this is depending on what's going to be happening in all of the different countries across the world. Since we had the first case in Mexico, which was February 28, we've had 49,219 cumulative cases. They were tested and lab confirmed. In the last 14 or 15 days, we have had 11,105 active confirmed cases, and we're going to give some details about that number and why it's continuing to still go up. The greatest activity, as we said before, is in the Valley of Mexico, and it still hasn't reached a stability point yet in terms of the number of cases and should be coming down soon. But when that happens, we will see some other cities, which we'll talk about tomorrow or the day after, showing some of the predictions and the cases identified. And so we will be able to see which areas are starting to have lesser transmission. So this number is across the country in the last 14 days. Unfortunately, 5,177 people have lost their lives due to complications from COVID-19. These deaths were mainly serious cases among the elderly. And in Mexico, chronic illness has contributed greatly to a lot of these fatalities, as well as smoking and obesity. These are both important contributors to fatalities from complications of COVID. Over 172,000 people have been tested, and just over 95,000 have tested negative. So it was ruled out that they had COVID. Now we see the distribution of cumulative cases. Basically no change. This has been relatively consistent throughout the epidemic. We can see basically that the most populated regions and areas in this bar graph, like Mexico City and the state of Mexico are those areas that have had the highest number of cases. Next, that we have Baja California, Tabasco, and Sinaloa. So in terms of new cases in the last 14 days is what we can see on this next slide here. There are 11,105 confirmed active cases. And we'll see in the next couple of weeks how some states like Baja California soon, which has now turned green, and some other states as well that were green before. This is where we're now seeing a decrease in the transmission of the epidemic. And so these are all the categories that have fewer cases. On the next slide, in bar graph form, we can compare the territories that have the number of cases. This slide shows the incidence rate. So this is the number of cases divided by the population. So across the country, the incidence rate is 8.68, almost 8.7 per 100,000 inhabitants. So 8.7 per 100,000 inhabitants have tested positive for COVID. We can again see here that the incidence rate has maintained steady in Mexico City, in Tabasco 25, and then below 15 in most of the other states that are shown here in descending order in terms of intensity of the incidence rate. All of the 5,177 unfortunate deaths have occurred on different dates. And we've showed this on this bar graph on which dates the deaths have occurred and the distribution per day. There's 582 which are still in the intermediate phase of testing. Lab samples have been taken and they're still awaiting results. As we can see here by state, the distribution is very similar to what we saw for the cumulative cases. The 5 places that had the highest level of transmissions in the beginning are the ones that so far have had the highest number of deaths. Next, please. These are confirmed cumulative cases, 49,219, and 27,500 suspect cases, which we've confirmed are not the same people, but some have been confirmed and other have been discarded, and some new cases are added as suspect cases. Right now, we're seeing the most activity of the epidemic, and that's reducing the number of suspect cases. Then in the epidemiological report, and this is about the occupancy and availability of hospital beds, we have 49,219, which is about just over 4% increase over the day before, and 2,075 new cases. This shows the corresponding point on the epidemic curve, the number of cases identified daily with the highest intensity of transmission and frequency of cases that are occurring every day. Next, please. On the map, we have the 739 reporting hospitals, which is people who are hospitals that report people that have COVID. We have a total of 13,700 beds that are available and 8,565 that are currently occupied. So next, go to the next one, please. This shows the availability in maroon or in brown and the occupancy in red. So we have a 38% occupancy rate and the other 62% is available beds. If we look by state, we can see Mexico City has 72% occupancy and 23% available. Then next, Mexico State, Baja California, Guerrero, Hidalgo, Tabasco, etc. On the next slide, we see the same thing, the same measurement of occupancy. But this is specifically for beds that have mechanical ventilators. So they are equipped to attend to people who are critically ill, people who have acute respiratory symptoms. So these are patients who have been confirmed to have COVID or who are simply in critical condition and require urgent care with respirators, but perhaps they have not yet been tested. Nationally, 32% occupied, 68% available. And on the far left, we have Mexico City, 31% available. Mexico State, 59%, 52% for California, Baja California, and so on. So now I'm going to pass the floor to Monica Macis.
Gracias. Muy buenas tardes a todas.
Thank you. Good evening, everyone.
Agradezco mucho al doctor López-Gatell la invitación el día de hoy.
I want to thank Dr. López-Gatell for today's invitation to be able to come here and speak about what we are commemorating on the 17th of May. 1 year ago, the President decreed that May 17th would be National Day Against Homophobia, Transphobia, and Lesbophobia. Based on that, the Ministry of Government instructed us to work intensely in order to reduce these types of attitudes that discriminate. And why May 17th? What are we commemorating on this day? 30 years ago today, the WHO stated that homosexuality was not an illness. So it removed it from its list of mental illnesses. And so this is extremely important and relevant, because what this does is, it's why we're commemorating. So we're celebrating life, the life of people in the LGBTQ community, and as well as the legitimacy of their projects and plans. So we can choose the life that we want, and it's just as valuable. That's what we're commemorating today. That's what we're fighting for. What are phobias? These are attitudes that are based on fear, on ignorance, and a lack of knowledge, as well as prejudices and stereotypes. And this can affect people's lives. It means that these people might have their rights restricted because of any given condition. And in this case, it's the condition of their sexual orientation, either being lesbian, homosexual, or trans. So we wanted to present some figures and statistics so that you can see just how prejudice can have an impact on people's lives. 3 facts. 4 out of every 10 people in Mexico are discriminated against. 4 out of 10 would not agree to have their child marry somebody of the same sex. So there's a lot of rejection within families themselves. So people can't always choose to be with who they want to be. 36% of people would not rent a room to a trans person, and 32% would not rent to a lesbian or gay person. And 4 out of every 10 people would not like it if a gay or lesbian person were elected to be president of the country. So these are some of the facts that we see in Mexico about this population group. So what we did together with some civil society organizations and other institutions, we called it EndoCit. This shows us the following. 3 out of every 10 people left home before they reached the adult age. So these are children and adolescents who left their homes because they were rejected at home and they were forced to leave, thereby exposing themselves to risks. 3 out of every 10 suffered physical assault at school just for being who they are. So this is physical abuse from their peers or other people at school, which is called homophobic bullying. half of the population had been unfairly refused work or a promotion. Trans women are the ones who are most affected in terms of employment, simply based on their condition. Almost half of people who have had problems in getting medical care have chosen to hide their sexual orientation or gender identity. This is extremely important today, which is why we are commemorating this day today. So what are we seeing at CONAPRED about the situation currently? The first source is the complaints that we get to CONAPRED. As I said before, once, discriminatory words that for some people are religious, that have been said against these sexual minority communities, they have been discriminated against or spread false information. Second, many young people have spoken with CONAPRED looking for guidance about what they're experiencing at home. Many of them went back home where I said before, they're not accepted, they're rejected. And many people whose gender identity is even unknown to their families. So this has become really complicated. And so we provided a lot of guidance on that aspect. And we're aware of what's happening at home with this population group. The third one has to do with people who have HIV. In some cases, they have had to reveal their status of being HIV positive, and they've had to go home and work from home. There's one specific case of one where a person was laid off from their job because that person revealed that they were HIV positive. So this is quite unfortunate. And at CONAPRED, we are looking into these complaints. For people who have these issues, they can call in. We have a very close relationship with civil society organizations that have been reporting and providing information and helping us to attend to this population. Based on the information that we're getting from these organizations, there's three situations that we see in these communities. The greatest economic impact is due to lack of work or precarious work. Many people in this community who are currently not receiving any income, they're very afraid because probably later on they will not be able to go back to their jobs. So this is part of the precarious economic situation. It exposes them to greater incidents of potential violence. As I explained before, many of these young people are experiencing these levels of violence. And normally they would be able to go to workshops or groups where they get together with their peers and friends, but now due to the isolation measures, they're not able to do that. And so it's creating a lot of anxiety. And lastly is the fear of potential discrimination if they seek medical care or critical care. And so I'm pointing this out because when we're talking about critical medicine, that is explicitly an aspect with which discrimination has no place. So what are we doing in concrete terms? It was 1 year ago that CONAPRED and the Ministry of Health worked together with this administration to come out with a protocol, an anti-discrimination protocol. This document has already been approved, and it was put out by the Ministry of Health and put out by medical and nursing staff. According to this protocol that was created together with a number of institutions, what we really did was to make a guide, a very simple summary, kind of like a smaller protocol. And in that, we have established the most basic and the most simple protocols for medical services, so that this group of sexual minorities can be given medical care without any discrimination. So how can we provide inclusive care or orientation on gender identity or sexual orientation? How can we provide this? So one is to use the name that trans people identify themselves with. So that's very important. And then secondly is to facilitate as much as possible that their partners or social family can take part in the decision-making process. So we could say that this is the result of also what the Undersecretary of Human Rights has been saying in all federal institutions. Any work that is carried out has to be based on international standards. So this guide that we worked on with Dr. Lopez-Gatell, it's already available on the Ministry of Health webpage so that it can be disseminated among the community and among medical personnel. The guide also has updated telephone numbers for civil society organizations where anybody from the LGBTQ community can call if they need help. We also have links to the Lifeline, with which we're working very closely, and also with the Gender and Reproductive Health Center. These organizations are all open and ready to provide service without discrimination. So the line that we have chosen through the government to channel all of this information is CONAPRED. And so we've made great efforts with 911, and we thank them for their collaboration to sensitize their operators to the specific issues with this community. That way they're able to refer them to the appropriate resources and channels. CONAPRED, as I said before, we've got the phone number up here, and conapred.org.mx is the webpage. The other thing I wanted to say is that this effort really happened within the 2030 agenda, which is no one left aside. So it prohibits discrimination based on sexual identity or gender identity. As well, this past weekend, we carried out a campaign. And this campaign was to reduce your phobias, reduce the curve of discrimination, and as well as flattening the curve of homophobia and lesbophobia. Thank you very much, Ms. Massis, the president of CONAPRED. We appreciate you talking to us about this really important day of commemoration for sexual orientation and gender identity. I hope that we can continue to build a very inclusive society that respects diversity of our population in this and other important aspects. But today, May 17th, we wanted to make it clear, commemorating the decree that was signed a year ago, that puts Mexico in a more progressive position. I just wanted to mention the protocol for health services, and I wanted to give credit where it's due. Dr. Simon Karasik, who's the Director General of Health Services, he was the main proponent of this document, and he's still working for the Mexican government, and he's been a very important collaborator for us. So he continues to help us, and now we can go from the document to the implementation phase, because there's still a lot of work to do in that area.
All right, let's begin with the Q&A period. You said before that you were gonna give a list of hospitals to which the ventilators have arrived and if they are operating already. Also, we registered more than 2,000 cases within 24 hours. Isn't it supposed to be... I thought the flattening of the curve was maybe 8, or maybe there was something I didn't get right. Also, you were talking about how if a state government or different institutions within a state decide to go back to normal before May the 30th, they would be going against the law. Can you comment on that? Yes, about the topic of ventilators, those ventilators, it was not the manufacturing of these ventilators wasn't completed in due time before the expected date that was May 15th. This has been a rather complex project that has involved the collaboration of both national and international organisms and institutions, and that has relied on the experience and the expertise of many professionals, especially the ones from CONACYT. Remember, CONACYT is the one who leads the way in terms of science and technology in our country. I don't know the specific date by which they will be completed, but what I do know is that the need for ventilators, that these new ventilators were gonna help meet, has been met through other means, such as by the purchasing of ventilators from the United States as well as from China. So no, out of the ones that have or are supposed to be produced or manufactured in Mexico, I don't think they are operating currently, but the project continues. And fortunately, they were not necessary to cover for the specific needs that they were originally thought of. I don't know the specific date, but I can find it out and we can present it to you this week. About the 2,000 cases, that's a very good question. Thank you for asking, because I know a lot of people at home are probably wondering the same thing, and it's a perfectly valid question. The epidemic curves are identified by metropolitan areas or by city, sometimes by region, like in Puebla and Tlaxcala, but not on a national level. And this is because the way epidemics behave is they exhibit a lack of synchrony. So with the cases of Brazil, of United States, of Russia, or of China, or India, the territories of these countries, of these nations, are so big that it is impossible for the epidemic to manifest in a uniform manner. So we had said the peak was May the 8th in the case of new registered cases, and May 15, May 18 for the peak of hospitalizations. But we had said that those dates were for Mexico City. They applied for the metropolitan area of the Valley of Mexico. So when we observe that more cases are being registered every day, this is because of two reasons. One is that we've had a similar number of new confirmed cases in the Mexico City area for the past few days, meaning we are stabilizing, but also we are having the added number of new cases that are coming from other states that, even though they are exhibiting lower transmission levels than the Mexico City area, they are increasing in their transmission levels. So that is the explanation behind it. And what about the states that are not or could not abide by the current regulations of the federal government? Yes, thank you for that. We've said several times that health authorities are, in this order, the President of the Republic, the Secretary of Health, the General Health Council, and the state governors, the state governments. And each of those levels of authority have specific responsibilities that are in perfect alignment with the Constitution and with the current laws and regulations. For the case of state authorities, it also has to do with the specific limits of their territories. The federal government, the Ministry of Health, the General Council, they have the authority to create general health dispositions throughout the whole country. So there is something we call concurrence that happens in other dimensions of the public life of the country, which basically means these authorities complement each other in the execution of their duties. So each level has different responsibilities. Because the federal authority is superior to, in legal terms, to the state authorities cannot do anything or make choices that go against what has been decided by the federal authorities. So, specifically talking about workplaces, school activities, and social activities in general, after May the 30th, the state authorities will be free of either maintaining the current restrictions or lifting them according to their own proper evaluation of risk. But what cannot happen and should not happen is the opposite, that the states, that the federal authorities has a restriction currently and the states go against it. So they cannot go against it before May the 30th. And regarding the municipalities of hope, as we have defined them in previous days, they have been defined as municipalities that are relatively dispersed, talking in terms of human settlements. They have low mobility levels and low communication levels in regards with other municipalities, and also they are not surrounded by municipalities that have had high levels or considerable levels of transmission. So there are sort of buffering areas for the pandemic. But this is a situation that could change at any time. And at any given moment, a municipality that appeared in green because there were no cases registered in that municipality, it could start having cases, and we could start seeing registered cases in that municipality, and then it would not be considered a hope municipality, so to speak. So I want to take this opportunity to talk about Dr. Carlos de la Peña Pinto, who is a very well esteemed colleague who is the health secretary for the state of Guerrero. Is telling me right now that the municipality of Copala, in the state of Guerrero, Copala is currently, or was, the municipality of Copala had been listed as a hope municipality, meaning there were no transmission levels reported there. But now, this is information I'm just receiving, one case has been detected, one case has been registered. So please, everyone in Copala and in Guerrero in general, know that the municipality of Copala will not be reopening any activities or lifting any restrictions tomorrow. And of course, the state authorities and the municipal authorities will have a proper tracking of this case, and they will continue to monitor the pandemic situation in this specific region. Thank you, Doctor. So, you were talking about these violent behaviors that can happen within families that can be associated to discriminatory behavior or some sort of phobia. So could you provide the contact of any institutions or any numbers of or persons that these adolescents that are subjected to some sort of violence, of domestic violence, can reach to get help? And also, we've had reports in some municipalities uh, of physical attacks that happened, and the victims were infected, COVID-infected patients. So, what are the measures that the government has implemented to deal with this kind of phenomena? And also, we've made an investigation about the sectors that are at the bottom of the economic activity. Well, the ones that haven't stopped, that are considered essential workers. For example, garbage collectors, police men, police units, or people of the sort. These are public servants in a way, and they are being exposed to high levels of risk because some of them have already fallen ill or been confirmed as COVID cases, and in general they are exposed. So I don't know if you could talk about the different protection measures that are available for them, or if you could pass the question to the governor of Mexico City. Also, you were talking about the managing of hazardous residue, and just in general, what are the protection measures available for garbage collectors? Thank you. Thank you for the question. What we have been recommending to the population, and specifically to those who are being subject to some sort of either maltreatment or mental health related issues, such as and not natural emotions like being upset for some reason or being anxious. And it doesn't matter if you're talking about people from the LGBT community or otherwise. Call 911. You can call 911 to have access to proper orientation, and it's very specialized orientation, the one you will have access to, because the 911 personnel has been trained and they have proper knowledge of in terms of what is a trans person, what is gender normativity, and this has all been done in order to facilitate a specialized attention for vulnerable populations. And I want to say that all of the accomplishments that we've had in these respects in the country and in the city are to be celebrated, and they are thanks. A big part of it are thanks to all of the different organizations that are active within the civil society. They've faced challenges as any other enterprise would face, but now through this guide that we were talking about, through this public set of guidelines, you can also have access to a directory of all the different numbers of these organizations that specialize in these sort of topics. But as a way of filtering or being more direct in the contact information that these people can reach, call 911. Call 911 and they will redirect you to a specialized unit that will be able to address any kind of problematic that you are facing. And regarding your other question, CONAPRED, we've been receiving some complaints and denounces relating discriminatory attacks, and discriminatory behaviors happening within institutionally. So this would be a matter of competence for those institutions, for the institutionalized areas that can address these problems. Not so much of CONAPRED. Yes, could we show This, yes, thank you for showing the website. I want to show it to everyone. In this website, which is the official government website for the coronavirus situation, it is the official information portal. If we scroll down a little bit, we can see how we have recommendations for the health personnel. In this section, you can access to all of the technical documents. This is all available material that you can have access to. And this other section is for the general public. So we have both sections. I don't know if we also have the set of guidelines for the control of infections. And if it's not here, I would like to ask Dr. Ricardo Cortés to also put it, to make it available for the public. Here we have different explanations regarding hygiene procedures. In this case, we're talking about hand sanitation, hand hygiene. But let's see. Let's go to the previous section. Yes. Here in the available materials for consultation. Yes, this is what I was looking for. Let's see. Scroll down. I cannot seem to find it. Well, I mean, we'll make it available at a more visible area. So anyway, this document, this is the guide of recommendations, and this has recommendations for the managing of utensils, of clothing articles, of dishes, and it has a specific recommendation that is the disinfecting of surfaces. Maybe you remember when Dr. Rosas was here a few weeks ago. She has very wide experience and expertise in this area, and she was telling to everyone that you should not mix soap and chlorine. You should use separate containers to handle them, because one of them inactivates the other. So this three-step procedure that is described in the guidelines is more than enough to disinfect any surfaces. So for example, if we have an infected patient at home, it is very important to pay special attention to the disinfecting of quotidian utensils. Now, to answer your question, yes, specifically the workers that work in the garbage collection sector, they are exposed to great risk because they are exposed as well to hazardous residues and dangerous materials such as broken glass or syringes or other materials that can harm them. So they have to use the proper PPE, the proper personal protective equipment. Thank you. Thank you, Poncho Gutierrez. Good evening. My first question is to Dr. Gatel. We know the next month we will begin this going back to the new normal that implies keeping safe distance and washing our hands frequently and a number of measures that we will have to continue to abide by. But what if a vaccine was discovered? Would we be also going back to this new normal? Or would it be a different scenario? And my second question, what happened to couples of the same sex that do not live in states that are as progressive as Mexico City, and they do not have the same protection for their rights. For example, if one of these persons go to the hospital and they fall ill and they are not able to make decisions for themselves because they are sedated or intubated, and their partner, because it is not legally recognized as their spouse, they cannot make decisions for them. So what would happen there? So, and in general, what would a couple like that be in a position of to do to protect themselves? Because they would be in a position of vulnerability. Well, first question, it is a hypothetical and certainly stimulating scenario to think that we could find a vaccine in the following weeks, and just in general, and it would be great that whenever we have that vaccine, we would have it in enough quantity so we could distribute it all around the world, and everyone has access to it, and it's safe to use, and everyone can be vaccinated. Well, that is definitely an encouraging thought, encouraging reality, but we are very far away from it, very far. So right now we don't want to focus on that. We want to focus on when it's gonna happen, which is going back to this new normal that will require an effort from us, and especially talking about this discrimination behaviors that we've been discussing today. Remember, lack of empathy, aggression, antisocial behaviors in general are elements that worsen a crisis. A crisis is something that we have to come together to face with solidarity. And let's hope all of us can contribute to that goal. With respect to your question, yes, this guide that we have launched, that is based on protocols that have been established since last year, has this focus. It wants to protect these people. It doesn't matter if they are married or not, and they want to protect these individuals and their social families. It doesn't matter if we're talking about blood-related individuals or legally related bonded individuals. We want to protect them all. And yes, your question is very relevant because we also have to explore what are some of the other areas of opportunity that we have to work on, because we have 17 states in Mexico that haven't recognized the right for gay people to be married and similar liberties. We need to all understand that these are rights that these people need to have access to, like any of us have access to our rights, and we have to accept it. And yes, we have more work to do in that front. For example, relating to providing the right of for a trans person to be able to legally change their name and their gender, and this is something we still have to work on. Yes, Paola Betancourt from Multimedios TV. I would like to ask you if you have detected what are the elements that are impairing the different doctors across the country from receiving the proper PPE, because some of them have had to present to search this equipment from legal using legal means and legally protect themselves so they can stop working until they have access to the proper equipment. So what is the status of this equipment? Are we still buying it from China? Also, more than 100 people within the health sector have died, why were not these people not isolated if they had pre-existing chronic conditions, and it was believed that they were at a higher risk than other health workers? Well, the information we have related this subject is varying continuously, and we have been updating it recently. So the cases that you just referred in your question of those hospitals, of those doctors that are not receiving their equipment, those are cases from 2 months ago, and they are related to a global scarcity of materials such as face masks, uh, gloves, goggles, and that situation changed afterwards. And then, since we established this air bridge between Mexico and China, we have a continuous supply of equipment. I later talked about a second phenomenon that was related to local distribution, in which we could detect some um, some situations of misuse and even embezzlement, and even some people who were stealing these materials to sell them um, outside of hospitals. So we had to establish a protocol to address this problem, and we presented that protocol 2 weeks ago. And thanks to that protocol, we were able to stop a person who was actually attempting to remove a ventilator from a clinic to sell it outside. So we've been doing a lot in this front. I don't know the specific case, the other case you referred. It would be great if you can give us specific information so we can do something about it. But I would like to emphasize, since we established the air bridge, we haven't had any situation of scarcity regarding the PPE. Actually, we are we're having 200 ventilators arriving tonight, and today there hasn't been any questions about tests, but we have 300,000 tests arriving today as well, and also we have gloves and other materials arriving today. And would it be possible for you to present a list of how these materials and medical protection equipment is being distributed to which hospitals and to which areas in the country? Yes, we have a weekly report, usually on Tuesdays. We present it here at the conference. We have presented it, and you can also access it through the coronavirus website. The information is available to the public. Well, yes, the information is available indeed per state, but maybe you can have a more specific statistic or list um, that specifies the hospitals. Yes, of course, we can provide that too. And related, those people who have these health professionals who have died, why were they not isolated? Well, first of all, these people who have unfortunately died within the health sector, just the same as the people who have died outside of the health sector, they had pre-existing conditions that are hugely prevalent in our country, such as diabetes, obesity, high blood pressure, and that are directly related to an oversupply of bad quality foods and low nutritious value products that are available in our country. So our health professionals, our health workers are also exposed to this, and not only talking about doctors and nurses, but also social workers, support teams, gatekeepers. So it's not like they were not isolated. They are executing their duties. They are doing their jobs, and of course, medical units are places of higher risk exposure. So We don't have much time, so maybe just a small question. Short. Well, we just had a report from the town of Tulancingo, San Miguel, in the state of Oaxaca, that just had a case confirmed. Do you have information about that? I don't have specific information about that municipality, but we are gonna, of course, communicate with the authorities in Oaxaca. And please, I want to emphasize this. Today is Sunday, the May the 17th, the National Day of the fighting against homophobia, transphobia, and all sorts of phobias related to the LGBT community. And tomorrow, Monday the 18th, we will begin with the gradual lifting of restrictions for those municipalities that have been established to meet the requirements and that have been denominated hope municipalities. But to the degree that we get these reports of new cases, those municipalities will not be lifting any restrictions. Thank you, and we'll see you tomorrow.